With Johnson's near-daily involvement from start to finish, Medicare was passed and signed into law a little more than 6 months after his inauguration, July 30th, 1965.
The discussion for national health insurance for the United States goes back all the way to the days of Teddy Roosevelt, but nothing was done with this until November 1945 when Truman called to Congress for a creation of national health insurance funds. Truman's idea of United States health insurance was open to all Americans, would pay for doctor visits, hospital visits, laboratory fees, dental care, and nursing services, but this bill did not get passed. President John F. Kennedy had the idea for the Medicare that we use today, but this was passed by President Lyndon B. Johnson. On July 30th, 1965, Johnson made Medicare into a law. The budget for Medicare was around $10 billion, and 19 million individuals were signed into Medicare for the first year. In 1966, Medicare coverage took place. Americans aged 65 and older were enrolled in Part A, and millions of other seniors signed up for Part B. The first major change to Medicare was in 1972. President Richard Nixon wanted the legislation to expand coverage to include individuals with long-term disabilities and individuals with end-stage renal disease. Legislation also gave those eligible for Medicare coverage more options, like Medicare Part C and Medicare Advantage. These were originally known as Medicare Plus Choice. The new private options offered attractive add-on benefits such as prescription drug coverage for new enrollees.
Government-sponsored health care for seniors and the disabled. First created in 1965, Medicare was designed to provide medical coverage to people on Social Security. It's often confused with Medicaid, which was created to provide medical care for those in poverty, but they're not the same thing. Medicare works a lot like health insurance, except the government is the one reimbursing doctors and hospitals, not a private insurance company. You become eligible for Medicare when you turn 65, if you're medically disabled before age 65, or if you have permanent kidney failure requiring dialysis or a transplant. Medicare is divided into several parts simply known as Part A, Part B, Part C, and Part D. Medicare Part A is similar to health insurance that covers you against hospitalization due to catastrophic events. It can also help cover a skilled nursing facility, hospice, and home health care if certain conditions are met. Medicare Part B provides coverage for medically necessary services such as outpatient care and doctor services. Part B also helps cover some preventive services to help maintain your health and to keep certain illnesses from getting worse. Medicare Part C, otherwise known as a Medicare Advantage plan, is another way to get benefits. It combines Part A, Part B, and sometimes Part D coverage and is managed by private insurance companies approved by Medicare. These plans must cover medically necessary services. Part C is more cost-effective and often offers better benefits than having Part A and Part B together, even if you supplement A and B with additional coverage. However, plans can charge different co-pays, co-insurance, or deductibles for the services they offer. Medicare Part D provides prescription drug coverage. This coverage may help lower prescription drug costs and helps protect against higher costs in the future. Let's say Gary, an active senior, is enjoying a parade. Suddenly, one of the elephants gets away and runs him over. He's going to require some time in the hospital. Fortunately, Medicare Part A is there to help offset his costs. If Gary had skipped the parade and instead went fishing and caught a cold, he wouldn't need a hospital stay, but he would have to see the doctor. In that instance, Medicare Part B would pay for his doctor's visit, and Part D would help pay for the medicine he needs to get better. So to sum it up, Medicare is managed by the federal government. Part A provides coverage for hospital stays and emergency care. Part B covers doctor's visits and routine health procedures. Medicare Part C, also called a Medicare Advantage plan, is like an HMO or PPO that is approved by Medicare and run by private companies. It combines the benefits of Part A and B and also gives you the option of adding Part D coverage if it's not already included. Part D helps lower your prescription drug costs, and you are usually charged a fee for each healthcare service or supply you get.
I like Medicare, but I think Medicare has problems with so many rules and things that it makes difficult.
President George W. Bush signed into law the Medicare Prescription Drug Improvement and Modernization Act of 2003. This added optional prescription drug benefits. Until this time, about 25% of Medicare patients did not have drug benefits. At the end of 2014, the Kaiser Family Foundation reported the number of Americans on Medicare as 49,435,610.